when I personally do surgeries, I always look at the end picture, which is the pros portion. Nobody cares how my x-rays look on the x-ray. It makes me feel better. But
Right.
I think what can make or break the deal is actually the pros. And then some people are afraid that, oh, I don't want to do surgery because what if there's a failure? What if this? What if that? Or no matter how good you place the implants, you don't know the whole picture because this is not, this is a, I call it multidisciplinary kind of
Hmm.
field. You cannot just love surgery and then forget about the pros. You cannot just love the pros and forget about the surgery. So they go hand in hand.
Welcome back to the All In, All On X podcast, where we take you behind the scenes of full arch dentistry, innovation, and the people who are redefining what's possible. Here we go beyond the procedures and into the lives of people shaping full arch dentistry. This isn't just about implants or workflows. It's about the lives we build, the decisions we make under pressure, and the leaders who push this profession forward when no one's watching. Get your head straight, because we're about to go all in. The All In, All On X pod is brought to you by JB Dental Labs, the elite lab trusted by full arch surgeons, prosthodontists, and digital forward practices internationally. JB specializes in precision full arch restorations, zirconia, PMMA, photogrammetry workflows, and fast turnaround times that don't sacrifice quality. JB delivers a truly digital workflow powered by their proprietary online portal for easy case uploads, real-time tracking, and fast streamlined communication. If you're looking for a lab that understands immediate load, passive fit, and the demands of modern all-on-X dentistry, then JB Dental Lab is redefining what a full arch partner can be. Learn more at jbdentallab.com. Tell them that the All-In, All-on-X pod sent you. Athena, how's my nose? How's my nose? How's my lighting?
Your lighting is fine. You always look good.
Well, I'm in a weird studio and your lighting looks great. You always look good. I think you are the filter on Graham and TikTok. There's all these filters you go through and you can actually hit the Athena filter.
No, I'm not videogenic. I might be photogenic, but I'm not videogenic at all. I try to
No,
avoid
you're being
cameras.
way too hard on yourself. I want to thank you for joining me on this Sunday. Check out my studio. Look, stay wild, mountain
Stem.
child, right?
Nice.
And down here I have a couch with fall colors, look like a pumpkin patch, right? You
You
like?
just got stuck in the fall, huh?
I am not. I am in an Airbnb in Salt Lake City right now. This is not my motif.
Are you sure, Adam?
I know. I like the neon pink with the fall colors.
Nice. It's beautiful. No, it's refreshing.
Put
As
together better
fall
than
as it
halfway all
is.
on fours. Yeah, right. You're in LA. Welcome.
Thank you. Thanks for having me.
Yeah, absolutely wonderful to have you here. I mean, I'm stoked about this. I mean,
Me too.
you're my buddy, my partner in crime at Module 1. I had to catch up with you at some point in time.
Absolutely.
You are you are very, very busy. Let me I gotta I don't think you really need much introduction, but I gotta say you have let me just give you a quick introduction. Um, you have a great reputation as a surgeon, as an educator, as a leader in this field,
Um,
and you've put in a lot of hours, long hours, into this profession of all on four high stakes surgery. You come from this whole all on four world has a lot of big personalities. And for a long time, it seems like there's not a lot of women in the room. And you have just helped to change and redefine that, I think, in some exemplary ways. I, I've been dying to say this, that you
Thank
didn't just
you.
break the glass ceiling, but I think you put an implant straight through the glass ceiling.
Thank you. That
So
means a lot to me. Coming from you, that means a lot. Thank you so much. I'm honored to carry that reputation.
no, you're carrying it and you're carrying it away in just exemplary fashion. I mean, tell the listeners, how did you gain this stature, this notoriety? What happened? How did you start out?
Well, I always wanted to do great things with my life. And I want to say I got lucky that my path crossed with my mentor, Dr. Sean, you know him. And no matter what podium I'm on, I'm always grateful to him because he was the one who showed me the path when I was disappointed in the field of dentistry, something that was not satisfying me after I graduated.
Mhm.
And then when I met him, he kind of helped me find this courage to push forward and find something that I'm really passionate about. So it all started there. And I gradually started building on it. I met great people in the field and I felt the motivation day after day. So that was the beginning of the journey with 4M and with Dr. Shani.
Yeah, Dr. Sean, good friend of all of ours. Take me back. When did you first meet Dr. Sean?
I met Dr. Sean in end of 2018.
Uh-huh.
Yeah.
Yeah. Was that your first career, your first job in dentistry was to go work with the 4M Institute?
No, I was working for 2, 3 months, different offices.
Okay.
I was working with PDS. I was working at a practice by myself, running that office a couple of days a week. And it was just bread and butter dentistry, and it wasn't satisfying to me. I was reaching a point where I actually wanted to either go back to school, do something else, or change my career for good,
Mhm,
or do a different residency, something that didn't involve the bread and butter. But then I met Dr. Sean through a mutual friend, and I went to see him when he was doing an all-over surgery.
mhm,
And when I went to the office and I saw it, I was like, that's what I want to do. He said, if you're ready, come on in and join. So we did an interview, and then gradually he kind of built on my experience. At the time, we had a prosthodontist, Dr. Ben Javed. I try to use this opportunity on every platform that I'm on when I
mhm,
lecture to bring up his name and his legacy because he's passed away. And most of the pros knowledge that I have, it comes from him. So I was fortunate enough to be able to work with two great clinicians in the beginning of my career.
mhm,
And what's most important in this story is that I built the foundations right. They helped me build my foundations right. I didn't cut corners. They didn't let me cut corners. And when the foundation was right, naturally, I was less scared to be able to tackle on different cases. And then I
mhm.
could build on that by meeting different clinicians, studying, taking courses. So that's what shaped my journey, basically.
I love it how you start with the mentors and those that are important for helping you along the way. I think we all have anybody who's successful has somebody in their past that helped them throughout the way. Uh, Dr. How do you say his name? Dr. B, the prosthodontist?
Dr. Ben Javed was his last name. Javed was his last name. Yeah,
Dr. Ben Jabed. Want to take a minute to give him, some credit as well, because you said he's no longer with us, but we owe a great deal of gratitude to our mentors as well.
absolutely.
Interesting that he started out in pros. So you come in, you watch Dr. Sean do an all-on X procedure surgically, and then you've got Dr. B teaching you pros. How do you think that
Yeah, he
that?
was also doing surgeries, but then he was a prosthodontist, so I learned about occlusion, about the restorative aspect, because I think what most people forget in this field is that, oh, I just want to go learn surgery and be done with it. But what a lot of people don't understand is that the pros can, literally ruin their surgery. So the both of them go hand in hand. And when I personally do surgeries, I always look at the end picture, which is the pros portion. Nobody cares how my x-rays look on the x-ray. It makes me feel better. But
Yeah.
I think what can make or break the deal is actually the pros. And then some people are afraid that, oh, I don't want to do surgery because what if there's a failure? What if this? What if that? Or no matter how good you place the implants, you don't know the whole picture because this is I call it multidisciplinary kind of
Hmm.
field. You cannot just love surgery and then forget about the pros. You cannot just love the pros and forget about the surgery. So they go hand in hand.
Yeah.
And a combination of the two of them, if you're taking a course, for example, in full arch surgery, you have to continue with knowing the pros aspect of it too. So a lot of people forget that they just want to jump ahead of themselves and get excited about the surgery part. They may not like the restorative. That's why they want to do the surgery, but they don't understand how important the pros is in the surgery actually. So the
I
bottom
love
line
it.
is between my two mentors, Dr. Sean and Dr. Javed, I got to learn both aspects and learn from them.
Yeah.
And I'm trying to deliver the same message to people who are looking up to me. They ask me what's my key to success, if you want to call it success. It's just that I learned the right way of doing things.
Yeah. You are very methodical in your approach. I respect that about you very much. It's not just about placing implants, but it's funny because everybody knows you as uh, this boss woman surgeon that just does these phenomenal procedures. I mean, when we look at
Oh, thanks.
Instagram, that's kind of what sells for dentists, right? The CBCT, the Pano, the Zygos. Don't you agree that's what everybody's like wanting to look at, wanting to see?
People get excited about that. Absolutely. That's what you want to see. And then I think you were there at the ADI when we were talking about complications. And a lot of people think that, oh, if I do the surgery, I'm going to join the cool people club. No, that's not that. The point is doing, for example, unnecessary treatment just because you want to belong to this field. I don't think it's the right way of starting things or doing things.
If you can place implants but can't scale your practice, this course is for you. Core Business breaks down how to build a 5, 10, 20 arch per month practice, generating millions of dollars of revenue, learning systems, teams, marketing, and leadership. Stop guessing, start scaling. Core Business, how to 5, 10, 20. One time only, April 24 and 25, 2026. We got interrupted for the little technical glitch. We were talking about your mentors, prosthetic mentors, Dr. Sean, 4M, getting you started. And I think you're well on your way. 10 years out right now, right? 10 years out?
10 years out of school. No, I graduated 2017.
Yeah, we're
I did
coming up on it.
residency 2018. Yeah, getting there. 8, 7, 8 years, 8 years.
Yeah, and you've accomplished such a tremendous amount in a short period of time. And now you're a leading educator in dental implants and all on four. Tell me about that.
What would you like to know about that?
Well, you've traveled not just in 4M Institute in LA, but you've traveled across the country and internationally in a short period of time. I mean, um, how do you know what how do you credit that? How did you accomplish that in a very short period of time, being so well respected?
I honestly, when I think back, as I said, it all started with Forum Institute. So I was given that platform to show my passion for teaching. And before that, when I was doing my master's degree, I was also teaching at the university. So that experience came with that. So 4M gave me that platform through our own institute. And then I think other people started noticing that, and then I got invited to different platforms to be able to share that. And I think what's lacking in the field is that um, I get a lot of girls obviously coming to me and they're like, "Thank you so much for paving the way for us," or I get that kind of encouragement from other people. And I think maybe I was that missing link to try to bring the newer generation of dentists who want to be in this field, and more specifically the girls.
Hmm.
So I think I got recognized for that, and I was honored to be invited. I joined you, I think, right after 4M.
Yeah.
And then I took this course through Neodent that helped me develop my speaking skills through DevWrite, which I'm very grateful to.
Oh yeah, Brody's
And
Brody's group at DevRite. Big shout out, Brody.
exactly. Oh, yeah, you've been through that too. Yeah, that definitely helped me be less camera shy or stage shy.
Hmm.
So that was a great program. So that helped me step into my big stage performance, basically, if you will.
So I love it that you're paving the way for more women to join this field because, so I mean, historically speaking, it is sort of a male dominated field, right? And you're
Yes.
kind of breaking all stereotypes of that, not just as a woman, as a Persian woman as well, maybe stereotypes in your culture. How was that for you coming up? Is that new for you, novel for you? Did your family encourage it?
Not really. My family was always supportive, obviously, but I always had this drive that I wanted to push the boundaries. It's just growing up, I was that kind of rebel, a calm rebel.
Hmm.
But in Iran, obviously, it's a difficult environment for women to follow certain passions.
Hmm.
I moved here because my family had moved here before me, and I was basically the last to remain there. So I joined my family here, and I found this phenomenal opportunity that basically this country gave to me. So I tried to not waste it. And I followed my passion and my dream.
Hmm.
Um, the field you mentioned, it's a male-dominated field. That's absolutely correct. But I always, again, use this platform to say that it is male-dominated, not because they don't want women to be in it. Obviously, the field appreciates good work. No matter man or woman, whoever does it, it's appreciated as long as you do good work.
Hmm.
And I got most of the encouragement from the men, actually. Anytime I go to all these seminars, all of the peers, all the doctors that come to me and they encourage me, that gives me more power to keep pushing forward. And most of it actually comes from men because there are more men in the field wherever I go to teach. So that shouldn't be a discouraging factor. This actually should be an encouraging factor for more women want to do this.
Yeah.
For me, I think one thing that has helped me is that I had a great support behind me, and that's my husband. I know a lot of girls, maybe they have families, they have children. Maybe it's difficult for them to put that much energy into their career. But I'm lucky in the sense that I have a partner that's understanding my passion 100%, supports it.
Hmm.
And he never actually stopped me. I never had to be worried about, oh my God, I have to ask whether I can go to Orca or whether I can go to Virginia Beach. And he always supports it 100%. And if it wasn't for that, if I didn't have a partner that would be supportive, probably I wouldn't be where I am today. No matter how hard I worked, I don't think I could flourish into the person that I am today.
Yeah.
So that's the one message that I want to give to partners, actually, not just the girls, just to be supportive of each other's passions and let each other grow together. So I think that's one of the key factors in my own success and journey.
Yeah. For sure. Spouses, and my spouse, my wife Allie's in the next room right now. And I couldn't do anything without my wife. And I think it goes across borders of, sex and gender. Just having that supportive partner at home is phenomenal.
Absolutely.
But and I'm happy to say that you got a lot of support from some of the men in the industry because I'm very supportive of women in dentistry.
Hmm.
And sometimes I'm on committees and tasked with putting people on podiums and speakers, and we just don't get enough abstracts or submissions from some women in dentistry, from the quantity, having a large quantity of women in dentistry. I'd love to see more women like yourself get up on the podium. How but, when I teach my classes, I always see 9 out of 90% male attendance.
Hmm.
How can we encourage more women to pursue this field?
Well, first things first, I think you have to like surgery. I think women mostly get into dentistry for the um I don't know how to say the word, but they want to do something delicate, basically. Probably we're looking at the cosmetic aspect of dentistry, perhaps. But surgery, first of all, it's something that you have to like. And if they like it, I think most people are scared of complications and not being to able to handle things. But no matter whether you're a girl or a guy, if you're in the field and if you have a good network, you are going to be able to find the solutions for everything that you face. So how I can encourage more people is that if you like it, you should just go for it. And then don't be afraid to pursue it, take the right courses. And again, I think, again, it's just my general thinking. I hope somebody can, shine some light into that if there are other girls out there that are hearing this. Is it because it's difficult for them to travel? Because not all the courses are going to be in your backyard. You have to go to different places. You have to be willing to put that time.
Right.
Is it the family time that doesn't allow them? Is it the children? Is it different commitments that doesn't let them get out there and try to do this versus men. I think it's easier for them to be able to travel and attend all of these different educational courses. So that could be one factor in my opinion.
Yeah, it could be. It could be. I think that there's a lot of maybe there's some truth to that. Um, just sometimes it just seems to be easier for the guys to go travel, I guess. I don't know what it is about that. I think that they should feel a deep sense of commitment to home and their children as well. If they just had that support that you have with your husband to get out there, I'm encouraging ladies, come learn, if not here or at 4M in California. Do you see more attendance by women when you're at 4M Institute because it's sort of your home field? Are they coming there seeking your knowledge and wisdom?
Still no, it's still more men versus
Is it?
women, that's for sure. Yes.
Yeah.
But we're
Well,
gonna change
so
that.
we're
Together
gonna
we're gonna
change that.
change that.
Let me put up your Instagram page one more time because
Oh, that'd be
if
great.
you're watching this on YouTube, if you want to feel empowered, and especially if you're a woman and you want to feel empowered, look at this boss woman here. Look at everything that she has accomplished. Look at the dedication in these eyes. I'm telling
It's
you
like you
what.
either come learn or I'm gonna come find you and hunt you down.
You ever think about going and traveling and mentoring for other offices?
Yeah, I do that actually. I do traveling mentorship too. So I may not be licensed in every state, but I think if there are people who can do the surgery, but when they get into their own offices, no matter if you go to Orca, you go to Brazil, all these other countries, you go and do bulk surgeries on live patients. Still, when you go back to your own office, you do the surgeries, there's still some missing parts. So
Right.
it's good for somebody to be there while you figure things out and show you the way. I go to the offices even out of state. They do the surgery. I'm just there for the peace of mind. I'm hands off, holding their hands just to make sure that they can, finish the work. I tell them what to do, not to freak out, and then I help them get accustomed to the system that they have in their own office, and I help establish it for them. So I do traveling mentorship a lot too.
So they can just get in touch with you through this Instagram page if they're looking for that.
Sure, yeah, yeah. I'm
Yeah.
very responsive on Instagram. Yeah.
Yeah, how do you find so much time? I see you're working a full-time schedule at the 4M at the 4M treatment centers in Huntington Beach, correct?
It's Long Beach.
Long Beach, excuse me. And then you're traveling all the time and teaching. I mean, I know you've got a great support staff at home. It's incredible to see you all around the world. Um, when you are, where do your travels primarily take you
You mean for work?
for work? Yeah, for teaching.
Wherever needed. Honestly, I don't know. It just depends on what I plan for the year, where I get the invitations from. So it doesn't matter. I've gone to like I went to Melanie's office in Maryland, literally less than 24 hours. I came there for a study club. I went there for a study club, came back less than 24 hours, and it didn't bother me because I find joy. It doesn't make me tired, if you will. So I work Monday to Thursday. Fridays, I usually do mentorships. Friday, Saturday, Sunday, if I'm traveling for work, it's usually I leave Thursday night, come back Sunday.
Hmm.
And because again, I don't look at it as a work opportunity. And then wherever I go, there's so much love and passion. And I get to spend the time with the people in the field that I only get to see if you're traveling. So that's kind of a mini vacation for me. So imagine if I come there and I hang out with you, how often do I get the chance to see you?
Right.
Or Ellie, or when I go to Orcal, these people who come from across the world twice a year, we get to see each other. So I look at it that way.
I'm looking forward to seeing you. You're coming back in
August.
August next. I think I have something here. Where is it? Yeah, August 6th through the 9th with Dr. Brandon as well. We're looking forward to having you here. But I wanted to
Thank
share this too because how do you get the time to do that?
I make the time. I make the time. So I hated working out, just so you know, like my whole life. I hated it. I never felt the commitment to go to the gym because I was like, I'm just gonna go there, smell the rubbers and sweat of people. Like, what's the point?
Uh-huh.
But about 6 years ago, I met my good friend and trainer, Upton. and I started working out with him, and I go after work. So I work 4 days, and I go to the gym straight from work. If I come home, I feel lazy. I hate going to the gym, but I go straight because I'm still on the run.
Mhm.
So I go to the gym because I know he's waiting for me, and I know that I don't have to think about what I'm gonna do. He's just gonna tell me what to do, and he helps me. And then I figured that with the line of work that we do, I have to build the strength. I cannot just be this little like tiny girl who doesn't have muscle in her body. So that was my motivation to build the strength so I can do this more because this is truly my passion. If one day I cannot do this, I don't know what's going to happen to me. So I'm doing everything I can to make sure it's sustainable. So I'm just trying to build the strength,
Yeah.
and just to do something between like long hours of work and coming home. I just do something just for myself. So that's a driving factor for me.
Well, I think there's a tremendous correlation between the mind and the body and the spirit. It's
Absolutely,
hard to
yes.
have a healthy mind without a healthy body. This goes
Absolutely.
back, I think, Socrates had a, saying about this. I'm gonna mess it up if I try to remember it verbatim, but, how the mind and the body are intertwined.
100% yes.
If your mind is half as sharp as that back, it's gonna do it's gonna cut like a 15 blade. Have you thought
Oh,
about competing?
competing. No, they
Uh,
keep telling me, no. Remember, I don't want to go on stage and show. No,
I
I
think
just do this for myself. I just do this for myself. Yeah.
it's hilarious to hear you say you don't like to go on stage when you're on stage all the time.
No, I like to go on stage and I like to talk and share. I don't like to speak on camera. I don't like to, but I do it. There are
Mhm.
certain things I would like to do, some things that we don't, and I try to always um overcome it's not a fear, this is just me being a little shy.
Yeah.
So I try to go move past that by doing it more. So if I don't do it, then I will never, build the strength to move past it. So I keep doing it until one day. But
Camera's the
yeah, it's the
place
stage competition on the stage, that's out of my league. No, absolutely not.
I think camera's the place to talk. We can actually edit here. You get on a live stage and you're at symposium or somewhere and you just can't if you say something, you just can't take it back. We have the ability to edit it, cut it out, and we can even string it together and make you say something you didn't even mean to say, much, reminiscent of, media these days.
Can blackmail me with that.
Yeah. So be really nice or we'll make you say something you didn't intend to say.
No, on the stage though, yeah, I'm a lot of people are afraid of saying the wrong thing or what if I forget? I don't rehearse it.
Mhm.
I just try to go there and share what I know. People don't know what you were meant to say if you don't rehearse it, if you just make the point. And I
Yeah.
don't like dry lectures. I just try to be myself. And then if I say something that I wasn't meant to say, or if I say the wrong word, I just make a joke about it and move past it. So that's my comfort zone there.
Yeah, you do very good. What's your favorite topics to speak on in dentistry? Is it business, surgery, pros, something else, culture?
A little bit of everything actually, because again, this is not just a one thing, and because I had the opportunity to be a part of a big team, and I kind of was part of that growth from the get-go, and I watched somebody who was really good at both surgery, pros, and the business,
Mhm.
and I got to just watch that and be a part of it and contribute to that. So I like to um, take that package and deliver it to other people who are looking forward to doing something similar. Because
Mhm.
again, it's not just one discipline. It's not just, oh, it's just a business. No matter how good you get at the surgeries, but you still need to bring those patients and be able to build your business around it. If they are passionate, you have to get the cases to be able to do that. And insurance is not going to do it for you. You sitting at your office is not going to do it for you. So you have to know how to build that business aspect. So I like to do a little bit of everything.
This segment is brought to you by JB Dental Lab, your go-to partner for full arch prosthetics, zirconia, PMMA, and digital workflow. With a proprietary portal, in-house designers, and an advanced education center, you will experience reliability, precision, and consistency. Visit jbdentallab.com.
Absolutely. Have you, being that you've attained so much already, have you started to look at the next phase of your career, or are there things outside of dentistry you'd like to get involved with?
Outside of dentistry, no. So if I go to a party and nobody talks about dentistry, I'm just quiet standing there, praying to God that somebody starts talking about it too. Outside of dentistry, not really. No, I haven't thought about that. No.
No, gonna stick with doing and teaching for a while. I mean, why not? You're young. You're so very young. You got. I mean, I'm 50, and I'm already thinking about not just my next career, but the career after that. So I think there's still
Which is
plenty of
what? What's
time.
your next career?
I don't know. I mean, I'm getting more into the consulting world, I believe. You
Okay.
know,
That's still
and
within dentistry though, right?
yeah, but I think it's I've had a couple of offers to kind of go outside of dentistry just a little bit, but that's hard for me because so much of my time is spent treating patients, and I love doing that. So I'm not ready to break away yet, but I've had some other offers to go in other industries for sure. But I'm leaving it open right now. It's all in kind of in God's hands, you know. I came into dentistry by accident, and I think the next career may be by accident as well.
Okay.
Yeah,
Well,
just
if you change your mind, dentistry will always be there for you anyway. So
I'm not like I say, I'm not going anywhere real fast, but maybe putting in some stepping stones to the next step. Yeah, I mean, it's all. So you think that dentistry will be your final career?
as far as career goes, yes, absolutely. Dentistry will be my final career. I don't mind coaching or mentoring or consulting within the field.
Mhm.
But yeah, I don't think I will change that for sure.
It's funny. I've people have always like sometimes people say to me, "Oh, you've made it. Look at you." And I'm like, "Well, I'm just this is just what I'm doing until I figure out what I really want to do when I grow up." It's just my little stepping stone to the next thing, whatever that might be.
I'm sure
So,
whatever you put your mind into, you'll be able to accomplish it. You just have to have the drive and the right reasons to do it, and you'll be successful.
absolutely. Luck is preparation meeting opportunity. So right now I'm preparing for something I don't really know what it is yet, I guess. We'll find out. Let's get back into the implants. What do you see happening right now in implant dentistry that everybody sees but nobody says out loud? What are the things that we need to watch out for?
I think unnecessary treatment, being overconfident, taking on the cases that you can do not know how to do, or you just try to botch them or just get through them. You think, oh my God, I did it, but you didn't do it the right way for the sake of your patients. That's the direction that I unfortunately see the field is going. So that's why I think it's our responsibilities as educators to try to bring awareness to that. And that's why I tell people, you want to do it great. You're passionate. You want to be the next Dr. Adam Hogan. Good for you, but follow the same path. Go through the sacrifices that maybe Adam Hogan made or Athena made.
Yeah,
Don't just jump ahead of yourselves. Just spend the time, educate yourselves, and then do the right thing. Take the right steps, and don't try to find shortcuts. Basically, so I just don't want to see a wave of cases coming that need to be redone. People at the young age that are getting treatment that they didn't have to.
yeah,
So this is something that's really saddening to me.
yeah. It's a tough spot for young dentists, for any dentist really, because we're all faced with running a business, ensuring that it's busy enough, ensuring that it's profitable, more importantly, ensuring that we have cases coming in and then not overprescribing work. I think that that's sort of a dilemma among all healthcare providers. So, how much do you differentiate your practice, or I say diversify your practice between full arch implant dentistry and other surgery and prosthetics within dentistry?
Can you ask your question again?
How specialized are you in other words? And from a daily perspective, are you just involved in fixed immediate load, full arch, or all on X?
No, we are a full service practice.
Right.
There are some of us who just do the surgeries. We have associate dentists who do the restorative aspect when it comes to finalizing the zirconias. We also, so not every patient that comes through the door is going to need all on four, you know.
Right.
So those patients, they still need to be treated, but we're not limited by the fact that, oh, it's either all on four or nothing. We don't push the patients to get the treatment that they don't need because
Hmm.
we're able to offer and fix their smile with restorative dentistry, with veneers, with single implants, even hygiene. So
Hmm.
that's why we have patients who are not just coming in to get all on four. They have the family members who come back and they need other treatment. And we have dentists who only are focused on that aspect.
Right.
And there are some of us who only do surgeries, basically.
So you take the temptation. So the temptation is not there to try to coerce somebody into a certain modality of treatment. I think that that's the answer. Is
No,
that you have
absolutely not. Yes, you're correct.
you,
You're right.
yeah. For a lot of smaller offices or people starting out, I hear this frequently. I'm just going to practice all on four. I'm going to open up an all on four treatment center from the younger docs. I hear that quite a bit. It sounds like you would caution them against that.
100%. Yes.
Yeah.
Um, 6, 7 years ago, yes, maybe this all on four was something newer. There were not that many centers who were doing this. And then people started seeing the value in that. And I call it the life-changing effect. Forget about I never talk about the money aspect of it. Um, people started doing that. And then that's what I'm saying when I say people are getting ahead of themselves. They're like, oh, I'm just going to do this every day. It's very difficult. You have to invest in it. You have to be able to bring the patients through the doors. And it's just not sustainable. And then you will only have to either push people to do what you want them to do, and then people may not trust you at the end. So
Right.
I think it's better to be a full service. If you don't want to do that, have people who are good at what they do in the restorative aspect.
Right.
And I think a multidisciplinary practice can definitely help with the growth.
For sure. And also help with the temptation of not over treating or treating the wrong patients. You know?
Absolutely, yes.
Yeah. When you have a smaller operation like mine, I'll add this to listeners. I have to know when to say no. If I don't have the time to cut a full mouth of crown preps, I have to be able to say, I'm going to refer you somewhere else. So that's, I think, very, very important.
Exactly. And then some of us in the field of general dentistry, we forget that the referrals exist. So just because you don't want to do it, it doesn't mean that nobody else can. You should have a good network around you to be able to refer. Even some of these difficult cases, you know how many cases I've had where I really thought it's outside of our scope, and then I sent it to Vichy in Arizona to be able to take care of that patient because I want that patient to get the best treatment. If I know 100% that I cannot give it to them, I'm not afraid to refer them to somebody who can. That's why having this big network of people around us who are educators, good at what they do, helps us at the end. So
Yeah. To be able to refer anything for the patient's best interest. You mentioned Vichy in Arizona, phenomenal full arch surgeon capable of the most complex cases, or even if it's they're in your consult room, and even if they just need a denture or partial, if you're not going to do it, be able to send it somewhere where it's appropriate. Um,
exactly.
fully agree. Vichy, and Vichy is he's been out there teaching with you at the 4M Institute, isn't that right? I think I've seen him in there.
Yes, so he teaches a remote anchorage with Dr. Sean. He comes out, I think, twice a year. Actually, it's coming this Friday. We have this sub. I told you to come, but you were not available. He's gonna do a subperiosteal life surgery at the institute this Friday. So yeah, I'm excited to catch up with him. And then he's in Arizona, so we're closer. That's why I send my patients to Arizona
Yeah.
because they're closer to us too.
Oh, if I had a patient that needed his expertise, I sent him from Virginia. He's very good. But you're in LA, so I can't say that without hearing Sheryl Crow in the back of my head. LA. A lot of dentists in LA. What is the marketing and advertising like for all on four work in LA right now?
It's very difficult. So we have multiple practices in Southern California. And there are like every year we're seeing more dentists that are advertising for all on four. Obviously, what we try to stand out with is our quality of work. And advertisement, honestly, it's you just have to try different channels of advertising. What might have something that might have worked 5 years ago may not work today. So it's just that we try different channels. We just try to, and that's kudos to Dr. Sean because he's on top of his marketing and he's always open to suggestions and he's always trying different things to be able to bring the patients in who actually really need this treatment with the highest
Mhm.
quality that we can offer to them. So it is challenging. It's not easy for sure.
So your strategy is just keep yourself elevated above the noise below, above the cheap work?
Exactly. So cheap necessarily doesn't mean better. Do you know how many people have come through the doors who went across the borders? There are great clinicians across the borders. I'm not saying that whoever offers cheap treatment is bad. I'm not saying that.
Mhm.
But I'm just saying that this is not a treatment that you should choose by the cost. You have to go by the expertise of the person who's providing it for you. But unfortunately, a lot of people, because of the financial circumstances, they try to go after cheap. But I try to not encourage that,
Of course.
just to look for the quality of the work.
When a patient comes in for a consultation, who sees them? Do you see them yourself, or at what point do you get involved?
I see consultations too. Usually in the mornings, I'm in surgery. We have an associate dentist who's on the floor, sees the consultations. We've worked together for almost 5 years now, so he knows what I look for in patients. So we're absolutely in line with
Mhm.
our diagnosis and consultations. And in the afternoon, when I'm done with surgery, I see my post-ops and new patients. So if I'm on the floor, I do that. So I like to connect with the patients at their consultation too.
So safe to say you have a system and of support.
Yes, absolutely. And that makes a huge difference. Honestly, you cannot do this just on your own. So
Yeah, for sure. Um, I always enjoy meeting my patients and being able to choose them psychologically. I suppose your associate probably knows what they're looking out for psychologically?
absolutely, yes, yes.
Yeah. I think that that's probably the ultimate, complication that a lot of young doctors run into. It might be safe to say, picking the wrong patients for this, type of procedure.
Yes, that's again getting ahead of yourself, thinking that, oh my God, this is the case that I want to take. But if you don't see those red flags, again, it doesn't mean that that patient should not get the treatment, but just maybe you're not the perfect fit for each other. Maybe somebody else can treat them. But if you think that there's a red flag that you cannot do your best for that patient, or if that patient cannot be happy no matter what you do, it's better to not just even start a It's better to just not start that relationship from the get go.
Right. So, prosthetically, let's get down to some basics for the listeners out here in dental implants. Let's talk about pterygoids. How often are
Okay.
you placing pterygoids on your patients?
I want to say a lot, almost every single patient, but not everybody. If I can get a spread from molar to molar, I usually don't do that. If I have younger patients, I always do that. If I'm supposed to have even a single tooth cantilever, I try to add the pterygoid now that I know how to do that.
Mhm.
Um, but yeah, I want to say 9 out of 10 cases.
Fair, that's fair. So do you start with the pterygoid first, as
I
in the
start with the
that's the
pterygoid.
protocol?
Yes, I start with the pterygoid first because once those are secured, then I know that okay, the rest is going to be okay because not you might look at something on the CT scan and then you look at the quality of the bone and then things might change. So I
Mhm,
always secure the posterior spread because no matter what, I can do something on the anterior between the premolars or the molars and then I can load the
mhm.
patient. So
Right. And what's your philosophy on zygomatic implants? How often, why, and when?
how often, unless absolutely necessary, I try to avoid them as much as I can. As Juan says, the best zygos are the ones you don't get to place.
Right.
So I try to avoid them as much as I can. And again, I had last year I had two patients who came from out of state, younger patients in like their early 40s. they were saying that they were diagnosed with zygomatic implants and they came to us for a consultation. And I said, actually, I can just do this traditional, if anything, with the help of the pterygoid implants. They would not believe me. They said, no, but I was told that, I had need the zygomatic implants. I said, look, I'm planning it here for you. You do not need it. Maybe they were trying to upsell. I don't know what the circumstances were. But I promise you I can do it. Even if, let's say, it's impossible and I cannot do it, then I'm able to do zygomatic implants. You're only not going to pay for it.
Hmm.
So I did it without the zygo implants. And I see some cases on social media, and I think that that could have been avoided easily with the palatal approach or
Right.
transnasal, all these other techniques. But then I don't know why people do that. Do we want to look cool? Do we think we're gonna be the god of dentistry if we promote our zygomatic implants? I don't know. Obviously, I'm not judging,
Right.
but I like to bring attention to the matter that if you're placing a zygomatic implant on a patient that's in their late 30s, then what are you gonna do 20 years from now? What's the alternative?
Yeah.
So I try to exhaust all the other options before jumping into zygo implants.
I can agree with that. Was there a time that you had just learned zygomatics where you were more prone to wanting to do them a little faster and post them?
I was excited. I'm not gonna lie. I was
Yeah.
excited, but I never thought that that's something that I want to do on regular basis. But my motivation was that I had a patient who I think you were at my lecture. She was my motivation to learn zygomatic implants. She was diabetic. I had to pull out her teeth and put her in denture while she was getting her A1C under control. And then when she came back with the controlled diabetes and I looked at her CT, like I had to place zygomatic implants for her. And I told her and I said, look, this is something that has to be done. I can refer you to another provider within the practice who can do it. Or I'm about to take a course and then I'll be able to do it for you. She said, no, I trust you. I've worked with you. I don't want anybody else touching me. So that was my motivation to learn zygomatic implants.
Hmm.
It was exciting for sure, but then what I learned from that was that imagine if I was in surgery and I never thought that I needed a zygomatic implant, but then I actually needed it. So that would build on my confidence. So when I need it, I could actually utilize it and do the service
Hmm.
for the patient. So
Yeah. So you're like me. It's a bailout. When you need it, you have it. And I've had a
exactly.
lot of patients come to me with, I was referred here for zygomatic implants. I would say probably more than half, if not three quarters of them, we didn't need to do the zygomatic at the end of the day. So very similar to you. If you were a young doctor right now, would you want to learn a pterygoid or a zygomatic implant? I say you are young, of course. If you were brand new in this
Thank
field
you.
of all on four, would you want to learn a zygomatic or a pterygoid implant?
Brand new. First define brand new. What do you mean?
Well, you're just coming out in the full arch. You've got your standard. You've learned your standard full arch all on four, and
Okay.
you want to branch out and you want to learn to eliminate cantilevers. Where do you start? Do you start with the visible procedure or the invisible procedure?
Invisible procedure. Yeah, when I asked define brand new, I wanted to say, okay, is it somebody who has actually done some arches and they understand the basics and now they want to build on it, or somebody who's just learned all on four and they're just gonna go and learn zygomatic implants. So
Right.
that's what I was referring to. I would definitely start with the pterygoids because that's gonna be helping you. Excuse me, that's gonna be helping you even avoid the zygomatic implants.
Right. I
So
like that
100%.
thinking. So what kind of a basis do you feel like doctors need to get involved in all on four when I mean, how many people ask me this all the time. I'm looking for your answer. How many implants should I have done? How many arches should I have done? What's your answer?
I don't want to put a number to it. Honestly, somebody might do 50 arches and still not do a good job. Somebody might do 10 arches and have everything, figured out and feel confident to take on the next step. I think it's best to learn the basics of all of four if you're 100% sure that you've learned everything. You have taken multiple courses, you have done some mentorship, you have done some cases of your own. When you feel like you're ready and you feel like, oh, you know what, I don't know if I should take this case or not, if you're scared or if you're afraid that, okay, what if I did this case and I lose an implant? What am I going to do next? Then
Mhm.
learning the pterygoid and the remote anchorage is going to build on that skill for sure. So I don't like to put a number to it, just enough for you to feel confident that you're ready for the next step. And we all know ourselves. So you can learn the basics. I think that it's good to, for example, with subperiosteals. So am I going to do it? Probably not. That's not something that I would want to do, probably. But do I want to take a course and learn about it? Sure, because then I know if a patient comes through the door, I'm not going to tell them, you know what, you're not a candidate for implants. I can tell them, oh, you are a candidate, but there's this person who can do it. There's this, I know about it basically. So you
Sure.
can take the remote anchorage courses, to a continue. Let's say you take a full arch course, and then a few months later, you can go and learn the basics of remote anchorage just to familiarize yourself.
Right.
And then you can slowly build on that. So learning about it is not a problem, but doing it, you have to do it when you feel like you're ready to do.
Yeah, and knowing there's between confidence and cockiness. When I know doctors who, you meet doctors who they don't have the skill, but they think they're ready to jump into some very advanced procedures. And on the flip side, I see doctors that have decades of experience in dentistry and they've taken 1,000 hours of courses and they still feel like they're not ready yet. So it's just something that has to come internally, I suppose.
Exactly.
Yeah. I can get you doing a subperiosteal implant. I promise you, you have the surgical prowess for a
No, I
subperiosteal
know. I'm
implant.
not saying that I don't. I think that I can do it, but is that something that I want to do? Probably not, because if there's
Yeah.
a complication with it, I don't think that I will be able to handle it.
Yeah.
So I don't know. I'm just gonna watch Vichy this weekend and see, what I get out of it. But I think that's something that I'm gonna draw the line and say, okay, I'm gonna stop here and not do it.
FP1 isn't just a prosthesis, it's a philosophy. Core preservation teaches how to protect bone, soft tissue, and aesthetics while delivering true FP1 full arch outcomes. This is where surgical discipline meets restorative excellence. Core preservation, FP1 done right. One time only in 2026, May 1st and 2nd with Dr. Knife Sonata. Just a few seats left. Register today.
We'll we'll be I love I did my first subperiosteal in 2006. People ask me all the time about placing a subperiosteal in the surgery, or the surgical aspects of subperiosteals come up all the time. And what I always have to emphasize is how minimal the surgery is.
Mm-hmm.
We just have to basically raise a flap from ramus to symphysis and get everything out of the way and drop it in. And either it fits or it doesn't. And I was taught by my mentor, if it doesn't fit, you're basically making a new one. You just abort it and make a new one.
Exactly.
But the real key to a subperiosteal implant is in the prosthetics. And
Exactly.
to
That's
do
why I
it,
know.
my mentor Truman said, if you want to make a perfect subperiosteal implant, you have to first be able to make the perfect denture and everything that goes along with that, vertical dimensions, condylar CR, occlusion. And then once you've made this perfect set of dentures, you go to the lab and you make the sub, and then all you have to do is drop it in. And so it's really quite simple. We can get you there. Sam Jarrett and I and Vishy can get you there.
I know, but we'll see. I'm excited to see it, but we'll see.
So
I just don't wanna, I guess it's the complications. I saw these dehiscence, but then again, it's a very rewarding treatment because imagine somebody who cannot even wear a denture, like, are they gonna be dentures for the rest of their lives and be miserable?
yeah,
So this is 100% something that I recommend for people to do. If they want to do it, that's fine. Or at least recognize that this option is available and send it to people who can do it for them, because it's not fair to the patients to not provide it for them. But it is, I say, I don't do it because I know somebody within our practice is going to do it anyway. So, or maybe I just
you
want to
gotta think.
settle for my actual skills right now. We'll see. But we might come in next time, and then I'm going to be excited about doing self-hyosteals after
Yeah.
Vicious course.
You can get it done. All you gotta do is go through, the perfect jaw relations and dentures. I'll never forget, I had this one patient, her name was Brenda. I won't say her last name, but she came to me with a completely atrophic mandible and very poor keratinized tissue, just knife edge ridge, resorbed down to the base, and a bag of dentures. And Truman said, You just gotta make I heard his voice in the back of my head, "You just gotta be able to make the perfect set of dentures." I built her dentures out of, impressions in orange wax in orange wax, and I made this set of dentures for her, and we got all ready to go into the surgery, and she said, "You know what? I don't want the surgery, I want my money back. These are the best set of dentures I've
Oh my gosh.
ever." I put in, like, 12 hours of work into a subperiod asshole and never got to do the surgery.
I never did it actually.
No, she didn't want the frame. She said the dentures fit well. She had this bag of dentures, and the lesson learned is, don't do too good of a job on the dentures.
No, again, because people will settle for dentures and they're like, "Oh, it will do," but then because probably they don't know how much better it could be if they didn't have the dentures, so
Yeah, yeah, yeah. No, I'm being
maybe once I
facetious, of
get
course.
that patient that I really, feel like I really wanna change their lives myself and I feel invested just like how I learned the Zygo, maybe I'll do the soft periosteo too, you never know.
Yeah. You just gotta once you start seeing it, you can't unsee it. I think last week I had, 2 weeks ago before I left here for Salt Lake, I had 4 consults back to back that all subs, and I mean, there's nothing else for them. It's just subs or
I
dentures.
know, I see more and more, and maybe I think maybe we're advertising the dental implants, and then more people are understanding that there's an option for them. But then a lot of these people have been told that they're not candidates for implants at all. Yes, maybe not for traditional ones, but they are candidates for implants. So
Yeah,
that's why I encourage a lot of the doctors to, even if they just like me, if you think you don't want to do it, at least know about it. Maybe that changes your mind, or at least maybe you understand and you can guide your patients towards that direction of getting the implants.
for sure. We go back to a couple other things in your practice. Sedation, IV sedation, deep general. What kind of sedation are you in?
We offer both. I do moderate sedation, and we do offer general anesthesia. We bring an anesthesiologist in who does the general or deep sedation. It depends if the patients ask for it, if they're too anxious, or if they have a complex health history. We recommend that they do it with general anesthesia. So we offer both.
So you leave it up to the patient to decide?
Yes, in general, we usually tell them it comes with the moderate sedation.
Mhm.
But again, if there are circumstances that require the general anesthesia, we book GA.
Do you have a preference?
I I prefer GA for sure.
Yeah. So
But I've
maybe
done
just
it and that's say it
maybe
again.
just because 'cause I'm a little bit more older and stubborn, I used to offer patients the choice, and then they kept on choosing the cheaper option of IV sedation, moderate, and I went, "You know what? I don't enjoy this, so you all have to get deep general." It's just the
No,
only
I
way it's gonna
100% agree
be.
with you. No, I 100% agree with you. I personally prefer the deep sedation and general anesthesia. But for me, I have done it literally every day for the last few years that I feel comfortable with it. A lot of people are scared of it. But I manage it, knock on wood.
Yeah,
But then there are some patients with us, since we don't have a general anesthesiologist that's staff, we're changing that soon. But sometimes I have a patient who wants to do a surgery literally right away, and then trying to book an anesthesiologist in the saturated market of Southern California.
ah,
With anesthesiologists, it's difficult. So it's good to have that skill. But do I recommend general anesthesia? 100%.
yeah. I just have the anesthesiologist, 3 days a week, and we just make sure it's full. And it's once in a blue moon that we don't have a surgery booked, and then we all just do whatever, but, we just kinda like, "If you build it, it will come." So I go, "This guy's here Monday through Wednesday, and we're gonna fill it."
No,
But
that's definitely the best way to go. 100% agree with you.
so what kind of prosthetics are you guys making for finals? What's your go-to? Are you direct zirconia? You want tie bases, bars? What are you guys up to?
Oh, a little bit of everything. So we do have an in-house lab where, and then I get a lot of patients from out of town, out of state. Um, I don't like to send them home in a temporary set of teeth. So we make them the long-term provisional with titanium wrapped with acrylic.
Mhm.
A lot of our patients get that instead of the first set, and then they come back, they can upgrade to zirconia. We do offer monolithic zirconia, I think monolithic is the best option. Sometimes with the pterygoid, you cannot do that. You have to have that bar extension. So it's just a little bit of everything depending on what's the best for that case, basically. But my preference is monolithic zirconia.
Yeah. I'm actually having really good luck with the monolithic zirconia and pterygoids. I'm not, there's only been a couple of cases where they were so far extended back I couldn't fit them into one puck, but that was my only indication so far. They've
Yeah,
been
usually
pretty
that
straight.
has been the challenge for the lab if they're like if the arch is bigger, if they cannot fit the right pot, so they do they add a metal frame.
Yeah. So I want to go back to you said you weren't born here. You came over when you were young. From Is that right? You were born in Iran?
I was born in Iran, yes.
Yeah. How old were you when you migrated?
I was 20,
You were
21.
you were 21?
You
Oh
know,
my
you're
gosh.
not gonna get into the age, just skip this.
I learned something new about you. I always thought you were just this teeny infant, coming
No,
over.
no. I actually didn't want to move here, and then my siblings were here. I'm the youngest in the family. My siblings are older than me. So they all moved here one after another, and then my parents were kind of juggling in between. They were coming and going, visiting. Then they decided to settle in the US, and then I stayed behind. I said I want to finish college. I don't want to move. And then I had no choice but to move because my friends were moving out of country, my family was here. So then I felt ready that okay, I was ready to take that step. And I'm so glad that I did because probably the path that I'm taking now would not have been the same had I stayed behind. It would have been a completely different path.
Yeah, I mean, do you think that you couldn't do you think you could have been a surgeon had you stayed in Iran?
No, so funny story is that I hated biology. So in Iran, if you go to high school, you have to have a major. It was between math, biology, and literature. I was a math major and I only had, I think, one course of biology and I hated it. I aced it, but I hated it. I couldn't, like, I didn't think I could memorize. I had to comprehend things.
Mhm.
And then I wanted to be an architect. I wanted to go to school to become an architect and engineer. And when I was planning to move here, I applied to university. I couldn't get into my hometown's university. And then at the time, you could apply for um, different languages in the university, like it was a literature sciences. And then I remember I was marking my sheet and I was like, oh, that sounds fun. French literature. I'm just gonna mark it. So, and then I got into that, and then that was the perfect opportunity for me to stay behind and not move to US. So I studied French literature. And then I moved here. I wanted to pursue architecture when I moved here. But then I was meeting with a couple of friends and then they were studying biology and they were like, oh, we're going to apply to dental school. I said, is it that easy over here? Because in Iran, it's really not that easy to get into health sciences. So I was like, okay, let me take a biology course and see how things work out. And again, I think the beauty of this country is that the opportunity is there. You just have to recognize it, you have to appreciate it, and you have to pursue it.
Mhm.
So the fact that I was able to take this 360 turn and just fall in love with biology through that one course that I took and see that, okay, if I study this, I can actually apply to dental school and become a doctor. So yeah, I started with a biology course. I took some prereqs. I wanted to have a degree from US, so I studied my master's in biology and neurobiology. And then I applied to dental school. So that was my story of going from math to literature to math to dental school. But I never looked back.
Do you think that maybe you just didn't think you were good in biology because that wasn't a career that many women are involved with from Iran? You were just weren't pushed in that direction?
No, I think it was more of a personality thing. I don't like to just sit down and memorize things. Again, like math and physics, I wanted to like be able to solve problems.
Mhm.
I almost never studied at home. I would just learn everything in the class when the teacher, I'm a lecture-based person. So I would listen and I would just be able to solve all the problems. And I enjoyed that versus sitting at home and memorizing and it just never made sense to me. It wouldn't satisfy me.
Yeah.
But then when I came here, the system was different. And in Iran, if you were to study things, it was never obvious where the questions were coming from. You had to literally memorize everything that was in the books, all the explanations that were like underneath the pages, like with the little asterisks. You had to like memorize all of that.
Hmm.
So, and then when I came here and I went to a course and then I learned everything and all of those would show up on an exam, I said, it wasn't that hard, so I can actually do this. And then
Hmm.
I started like enjoying more of the biological sciences. So,
So, do you ever, okay, so with everything going on in Iran right now, do you see yourself, because you said you didn't want to leave Iran in the first place,
mhm.
and now you're an LA girl. Do you see yourself going back one day? Are you excited to get back? Tell me about that.
um, it's a tough question to answer because like this feels more like home to me. Do I want to go back and live there? I don't know because everything is so uncertain. I don't know what I can picture for the future of Iran. Will I go back to visit? Sure. Will I go back to take everything, like all the knowledge or the expertise that I have, take it back there and introduce it alongside other doctors who are already doing it? I'm very passionate about that. Would I go back and live there? I don't think so. Not for a specific reason. It's just because this is my home and I'm established, and I don't think that I want to change that. But I will be happy to contribute in any way that I can,
Hmm.
so I can help build that future, basically. So it's going to take a lot of effort for all of us to build that country back. So I would love to be a part of it, but we'll see how what the future holds, basically.
Yeah. What has the last month been like for you and your family, in light of all the world events and regional events in the Middle East?
Honestly, it's been challenging. It's even though you're not there, but our minds constantly are busy with the thoughts of uncertainty of what's going to happen. I know that a lot of people, I'm really active on Instagram to try to kind of deliver our story because a lot of people don't know. They just see a war, but they don't know what brought us to this point where we're actually happy about this war.
Hmm.
47 years of oppression has not been easy on most of us. A lot of us, not me, but a lot of people from Iran, they moved out because they didn't have the opportunity to be what they wanted to be. They didn't have the freedom. They didn't have the basic human rights. And they decided to move out. And a lot of people don't know that. A lot of people think, oh, how difficult could that have been? Well, if you're living in a free country, it's difficult for you to understand that.
Hmm.
But all I'm asking from people is to just not judge based on what they don't know. Those of us who are, you know, rooting for our country based on the life experiences that we've had, we're trying to just basically show the world the oppression that we experience. And we're all asking for people to not stay in the way of it and just let things run their course. Are we happy about the war? No, nobody likes the war, but I think we are safer when there's an airstrike versus living in the streets of our country because our own regime is actually killing people in the streets. So if there's
Yeah.
casualties with the war, so be it. But if we can change these all these years of killing and oppression, then I stand with it for sure.
Yeah. I think that that's, very understandable viewpoint, very noble as well. The the Iranian culture, I mean, going that country really goes back about 5,000 years, no? Isn't that right?
I don't know how many years, but it's a lot of years.
It's a lot of years.
I should probably know that.
It's, withstood a lot of occupiers. It's interesting, they say, and I'm asking your opinion, they say that there's a lot of similarities between the culture of the United States and the culture of Iran. As far as, now, aside from the oppressive regime that is being ousted right now, do
Mhm.
you find any truth in that? Any similarities?
I'm not sure what I can refer to.
Yeah, being that you were younger when you left. I guess in terms of education and technology, going back, before the regime
Oh, yeah,
of
yeah, yeah. So
1979.
yes. So Iran was a very we were basically ahead of the world, if not toe to toe.
Mhm.
Um, People were educated, people were very modern, um, achievers basically, very westernized. And then this is before the revolution. And then the revolution, it mixed the religion with the way of living, and that kind of stopped the growth, in my opinion. So yeah, in that sense, absolutely. We're after technology, we're after the growth. We always want to be on top of, every field, just like in America, that's for sure. And I'm excited to see that's happening for us
Yeah.
alongside US
It
and
is.
most of the westernized countries that are actually pushing forward, not going backwards.
Yeah, it is exciting. I'm excited for you.
And
And my
thank
other
you.
friends, Pere and Vishy, there's so many, and Dr. Sean, there's so many great Persian influences on this industry and also on this whole country.
Thank you.
What is it like growing up? Why are there so many successful Iranians in America? What is it about the home cooking in your households growing up? How do you guys breed such intelligent people that are so pervasive among our culture in the United States?
Well, as I said, when I was talking about my journey, we are high achievers. We like to be educated. We like to push forward. We like to, grow. And that culturally has always been there, like growing up, obviously it's not funny, but it's a joke among like Persian families that everybody has to be an engineer, a lawyer, or a doctor. So
Yeah,
that's the mentality that the children are being raised of. Like it's not in the form of dictatorship within the family, but we have high standards, We try to have certain standards and have the children follow that just so they have a motivation to grow. And then what US has provided for us is that the freedom to be able to pursue what you want. There's no stop. So if I want to become a doctor, I came from a completely different background and I saw that opportunity and I tried it and I pushed forward. The opportunity is there, so you just have to find it and follow it. Whereas in Iran, there are so many different variables where you cannot pursue what you actually really want. Even if you do it, you don't have the room for growth. That's why so many brilliant minds, they get their degrees, they cannot flourish in their own fields, especially in the field of technology and health science, and they move out and they're like the best of the best that has been in every country. So
yeah. Amen. Well, you're definitely high functioning contributors to society. I'll say that much
thank
for
you.
sure. And thank you for that. Well, I know I'm looking forward to spending some time with you in August
I
at
can't
our
wait for
base
that,
girls.
honestly.
Yeah, I can't wait for that either. So I can't wait to see you again. And where can they come and find if this airs in a couple of weeks? Where can they find you in the meantime between now and August? Where are you speaking?
So we have a full arch course at Forum Institute in end of March. Um, I am going. I forgot where am I going. The only
Got to be a
courses that
symposium
I'm
coming
going
up.
to Orca. I'm going
Yeah.
to Orca in September. There are a couple of other engagements that I'm trying to figure out. Probably in May, I'm speaking with our team at the DDS marketing event. It's a business and tech event in
Mhm,
Miami. Actually, it's May 15th, 16th. That's
mhm.
something that I look forward to connect. And yeah, there are a bunch of things coming up. But as far as the full arch course, the next full arch course is at Forum Institute end of March.
This episode of the All In All NX Pod is powered by JB Dental Lab, your full arch lab partner for predictable, beautiful, and digitally precise results. From provisional same-day conversions to final zirconia, JB delivers consistency, communication, and craftsmanship that elevate your practice. The proprietary case portal keeps your team connected with quick communication and real-time updates, while their in-house designers and comprehensive of full arch services ensure precision from conversion to final zirconia. If you're looking to grow your skills, JB's Educational Center hosts hands-on courses with live surgeries. Ready to streamline your All-on-X workflow with a lab that truly understands the surgical and prosthetic connection? Visit jbdentallab.com and tell them the All-In, All-on-X pod sent you. Thanks for listening.
So I was asked, I'm a little remiss. I was asked to go speak at that DDS marketing event, but we're running our own module 3 here in Virginia Beach. Now,
What?
now that I know you're going, I might just have to cancel my module 3. Go,
That's
go to
tempting.
Miami with you.
Don't
It is
cancel,
that.
just push it a week.
Yeah. Oh my God. We've already got the thing almost sold out. If I try to push it 1 hour, I'm going to get
I
angry
know, I
voicemails.
know. There are a lot of things that I sometimes cannot attend because we already have a course that we're committed to, so I get it. But you'll be missed
Doctors,
for
you
sure.
can't move it a half an hour. My flight, my flight. Mm. All right, Dr. Athena, 20 years from now, looking back, what do you want the public, what do you want other doctors to remember you for?
I want them to remember me for my strength. I want them to remember me for the kind of person that I am, that I always try to be humble. I try to be encouraging and inspiring. And that's the legacy that I'm trying to build, that I'm there for people, and that I do good work. So I hope that I'm remembered for that.
Well,
That I could make a difference in our field, for sure. I'm working towards that basically.
from my perspective, not that you need my validation, but you have checked everything you just said there. You have
Thank
checked
you.
that off along the way.
Thank you so much. It means a
Yeah.
lot.
I want to thank you for being such a strong woman and leader in our industry for other doctors to aspire. And I want to thank you for taking your time to educate and contribute to their development because
Thank
we need more mentors like you.
Thank you so much. I appreciate that. And then again, I wouldn't have been here without mentors of my own, without people like you who I call friends. And wherever I go, everybody's so kind and encouraging to me. And thank you for giving me this platform to be able to share that. So that truly means a lot to me. I cannot do this on my own. So thank you for letting my voice to be heard through your platform. That's an honor.
Yeah. Well, you have an open mic anytime you want to come back. If you have something to say, let me know.
Thank you so much. Well, it looks like I did fine. I didn't sweat so much. So looking forward to the next one.
We can't see it. And I'm glad you got the headlamp off. You took the headlamp off from the
Me
beginning.
too. That was literally bothering me. So
Oh,
thank you so
very good.
much.
You want to play a song on your guitar before we go?
Me plays oh, I that's my husband's actually. He's a musician. I have 0 talent for music. He tried and then he was like, "Just forget it."
Well, maybe
He's
if
a
he plays
talented
while you
musician.
dance or something. I don't know.
That's I don't think he's more camera shy than I am, so
Okay. Well, I want to thank you for spending a little of your morning and your Sunday with me. I can't
of
wait for
course,
this to
pleasure.
drop for everybody to see you. And with that, I'm looking forward to seeing you in August. And have a great rest of your day, Athena.
Hey, if today's conversation resonated with you and you're looking to sharpen not just your technique, but your judgment, your discipline, and your long-term vision, then this is exactly why we built the Atlantic Implant Institute. This is not just some highlight reel. This is not just some collection of disconnected modules. This is the core continuum for education and full arch workflow. It begins with Module 1, Core Bootcamp Fundamentals, where we establish surgical foundations, diagnostic discipline, and repeatable decision-making under real-world pressure. And then it continues with Module 2, Advanced Prosthetics and Full Digital Workflow, where occlusion, vertical dimension, aesthetics, condyles, and execution all converge. And then we have Module 3, which tackles remote anchorage, pterygoids, zygomatics, complex anatomy, taught through biomechanics, planning for predictable outcomes. And after the continuum, we have modules in FP1, fixed immediate load, and also business, how to 5, 10, 20. This is business leadership and operational strategy so that you can build surgically what actually works in practical business. If you're ready to go into full arch dentistry with intention, structure, accountability, and purpose, you can learn more at theatlanticImplantInstitute.com.